When you go to a doctor or a surgeon for treatment, you expect to see someone with a properly accredited medical qualification, right? Well, it's hard to believe, but that's not always the case. In Australia, there's a group of practitioners performing complicated operations who don't have medical degrees. They're allowed to call themselves podiatric surgeons, and they say they have their own special credentials which enable them to treat foot and ankle problems. But in this joint investigation with the Sydney Morning Herald and The Age, you're about to see how multiple patients have been left in chronic pain and with lifelong scars by these practitioners. All right, so what are we looking for today?
Well, I'd like to find a sandal.
Sandals?
And well, boots are my go-to, so I could try on a boot as well.
Almost any woman will tell you shoe shopping is one of life's true pleasures.
That's lovely too. That's beautiful.
Very elegant.
It is.
But for Suzanne Hogan, retail therapy has become a futile, almost comical exercise.
What size would you like to try then?
Well, I have a 10A left foot and a 7C right foot.
Oh, I see.
I don't know if you can accommodate that.
Try these boots.
It's not only embarrassing for Suzanne, it's painful and distressing. Over the past decade, she's lost 3 centimetres off her right foot, the result of 3 operations performed by a Sydney podiatric surgeon. Podiatric surgeons are a small and relatively unknown group of practitioners who have their own set of qualifications to operate on feet and ankles. But there's something they rarely tell their patients.
Comes out in his white coat and says he's a doctor and a surgeon and that he's going to operate on your foot. Of course you think it's a medical doctor that you are conversing with.
When Suzanne later learned that the person who performed her surgery was not a medical doctor, she was stunned. But in fact, of the 41 podiatric surgeons listed as operating in Australia, not a single one of them has a medical degree, and none are accredited to perform surgery by the Australian Medical Council, known as the AMC. So a lot of these podiatric surgeons aren't actually real doctors.
They're not medical doctors at all.
14, thanks.
Dr David Lunz is an orthopaedic surgeon and Australia's preeminent foot expert. If someone's calling themselves a surgeon, you sort of assume they're a doctor and a properly qualified surgeon.
Well, you would think so. And we've been fighting to have the title surgeon and doctor as protected titles for a very long time.
Dr Lunz is also president of the Australian Foot and Ankle Society. He's fed up with fixing feet after operations performed by podiatric surgeons.
Sometimes I've seen surgery that shouldn't have been done in the first place. Sometimes I've seen cases where the damage that has been done is not repairable. So if a joint has been injured or damaged, once a joint is damaged, there's no recourse.
So it's not always fixable for these patients?
Absolutely not. I've had patients who've had to have toes amputated. It's really soul-destroying when you see someone and you look at their x-rays and you think, well, why did you have that operation?
It's a question Katharina Doyle asks herself every day. You wouldn't know it to meet her, but the 63-year-old flight attendant has relentless shooting foot pain. Last year, Kathy was referred to a podiatric surgeon to fix a common problem, corns on her toes. Did you have any concerns about the surgery?
Well, I didn't, because he was so confident, and he said he did a procedure where he released the tendons of the toes, and that alleviated that problem, and he was confident that that would improve my problem with my feet.
What was the recovery like from that surgery?
Really long and painful. My feet are constantly painful and hurting. There's a burning sensation there, and it took a long time for my toes to feel like they were safe to actually walk on and move.
The operation performed by her podiatric surgeon didn't help. and Kathy says it caused even more pain. She's already seen an orthopaedic surgeon to see if her feet can be fixed. The answer was no. But today, she's seeking a second opinion from Dr Lunz.
Could I have your left foot, thanks? Now, can you curl your toes for me? So there are no tendons that curl them. Can you curl the big toe?
No.
And the joints in the toes are all stiff. Well, it sounds like she went in for one problem and was led down a pathway towards another surgical solution for a problem that wasn't really causing her a problem.
And is now worse off.
All I can say is that there's nothing that we can do surgically now to fix it.
Well, for an operation that was meant to go for 40 minutes, it's affected my life.
Like Kathy and Suzanne, this woman, we're calling Joanne, has irreparable damage and pain from podiatric surgery. In 2003, she had an operation to ease a relatively common but debilitating condition called hammer toe.
The recovery was a nightmare right from the word go. I was in so much pain post-operation. I was in so much pain.
And what did your podiatrist advise you?
He didn't know what to do. He gave me over the counter. There was nothing prescription, so it wasn't until after several weeks that I realised he was unable to provide me any pain relief.
And why was that?
Because he wasn't able to write out a script.
That's because Joanne's podiatric surgeon, Ozan Amir, is also not a medical doctor and therefore can't prescribe medicine without special approval. And why is that such an issue?
When you're operating on someone, you're not just operating on a hand or a foot or a toe, you're operating on a person. That person has got medical conditions, they've got cardiac conditions, they've got vascular conditions. You can't just concentrate on their foot or their toe or their ankle. You have to know how their medical conditions play into it. You need a holistic approach to understand what that person's health is and whether you, in fact, should be operating on them or not. The AMC, which accredits surgical training in Australia of all surgical specialties, has never accredited podiatric surgery training anywhere in the country.
And why is that?
Because the standards are just not the same.
Someone's cutting open my feet. I want to know that they're a proper medical doctor.
So there's lots of different ways of performing a healthcare service.
Associate Professor Cylie Williams is the chair of the Podiatry Board of Australia, which oversees the registration and regulation of podiatric surgeons. She says these practitioners have specialist training and accreditation to operate on feet.
As far as the training that they undergo, it is an accredited course.
Patients we've spoken to who have had problems after podiatric surgery have been quite alarmed to find out that those surgeons were not in fact medically trained doctors.
We message very strongly to practitioners about ensuring that when they are consenting a patient for anything, and both podiatrists and podiatric surgeons, part of actually doing that is understanding who is doing what and making sure that the general public does know when they are seeing someone what their role and qualifications actually are.
Associate Professor Williams, a podiatrist, is understandably defensive of the criticisms levelled at podiatric surgeons. But she concedes there's a problem. In a clear admission, the system is flawed. The board has announced an independent review into how podiatric surgery is regulated. What has sparked this review?
We have seen recently an increase in complaints.
What sort of changes could come from it?
There could be anything from strengthening our current procedures and registration standards right through to reform in how there's a podiatric surgeon may actually enter onto the register. It might be about titles.
But are you confident from where you sit that this review can properly delve into some of these concerns and complaints that have been raised and have a good look at how podiatric surgery is regulated in this country?
I genuinely hope so.
A left 41 and a right 38, which hopefully...
For those who have been permanently injured by podiatric surgeons, it's too little, too late. Suzanne Hogan lost 3 centimetres from her foot after 3 surgeries by Dr Paul Bors to fix an old sporting injury.
So what has he taken out of your foot?
The end joint, this end ITP joint is taken out. And then also when he fused, or when he did the capsular interposition, apparently, I didn't know, but you've got to sort of grind down the bones to put the tendon in there. So that's how I lost another 2 centimetres.
Even more shocking, at the time Paul Bors was treating Suzanne, he was also being investigated by the regulator and was ultimately found guilty of professional misconduct. What did you learn about Dr Paul Bors?
I learnt that you have to do your homework when you're engaging a practitioner. I was quite shocked that he was found guilty and was pending suspension about a month prior to my 3rd surgery. So he was already found guilty.
It's really changed your life, hasn't it?
Well, it has in the respect that I'm in constant pain all the time. The discomfort and the pain never goes away.
So you're just really focused on trying to keep yourself going?
All the time, yeah. Because of the damage to the nerves after the cutting of the tendons, I get like electric shocks in my feet, but I've just adjusted to the different level of pain.
Kathy Doyle was treated by a different podiatric surgeon. Her feet can't be fixed either. Her ability to work and her quality of life now depend on pain management. She hopes the podiatric surgery review will mean others won't have to suffer as she has. Do you feel you were informed about exactly what was happening in the surgery or the risks involved?
I really had no idea what I could potentially end up with, which is now toes that don't work properly, feet that ache and toes that ache all the time with this shooting pain.
My advice to people would just be very, very careful who operates on you, because they don't grow back. And there's so many, the feet are so complex with sort of tiny bones and muscles, and and it's got to carry your body around.
They've got a big job.
Got a very big job. So, it's very serious.
Joanne sued her podiatric surgeon, Ozan Amir. The case was settled with a payout. He currently has conditions applied to his practice by the regulator, but is still operating. Joanne has had 3 corrective surgeries performed by an orthopaedic surgeon.
I don't want anyone to go through what I did. It's not fair. I mean, you pay good money for this operation and I got nothing but I feel like I've been to the butcher shop, to be quite honest with you.
Hello, I'm Amelia Adams. Thanks for watching 60 Minutes Australia. Subscribe to our channel now for our brand new stories and exclusive clips every week. And don't miss out on our extra minute segments and full episodes of 60 Minutes on 9now.com.au and the 9Now app.